Benefits Review, which we affectionately known as call it CHBRP. I'm joined by Garen Corbett, our director. Garen, you want to say anything before we get off?
No, just welcoming everyone on this rainy day, and thanks for joining us.
Awesome. So today we'll be giving an overview of what we do at CHBRP and give an idea of how best to work with us during the legislative session and beyond. We'll also provide a rundown of some of the publications that are most useful to folks who work with health insurance benefits. And we'll have plenty of time for questions at the end. So if you have any, throw questions in the Q&A function and we'll get to them right afterwards. So what is CHBRP? We were established in 2002 by the California State Legislature, and we get reauthorized every few years as one of the programs that ends up sunsetting at some point. But basically, we are a neutral entity based out of the University of California that responds to requests related to health insurance benefits in proposed legislation. We're independent and we're multidisciplinary, so we remain neutral throughout the entire process. We don't get to choose our analyses. We only respond to the ones that are actually formally requested by the state legislature. And so there are a couple of different parties that can request things, the health committees, the appropriations committees, and then the leadership in either house. We provide evidence-based information on our analyses, and we'll get a little bit more into what those analyses actually look like. But none of our analyses will include recommendations. That is part of the wonderful thing about CHBRP. We provide the data and the details on what the evidence says right now, and provide it to the legislature for them to discuss the merits of the data that we've collected. And we are another thing that we do on top of our analyses is we provide resources on health insurance policies specific to California. One other thing that I should mention, we get this question a lot on how we are funded. There is an annual assessment on all of the health plans each year. So all of the plans that are regulated by the Department of Managed Healthcare or DMHC, and those that are regulated by the California Department of Insurance or CDI. And that money gets transferred to the state and then it's provided to UC and we get it through that assessment. So there's no impact to the general fund at all. To talk about a little bit more about how we do our work, we have a very small core team. We've got 4 staff that are full-time and work year-round on publications, prepping our models and templates, and overall getting ready for our high season. But we get our analyses done by collaborating and working with several other groups of experts. So we have about 40 faculty or staff researchers across the University of California and other higher education institutions. And they help with actually creating each section of our analyses, which I'll talk about in a second. But then to help with background and make sure that we understand the policy, because we are obviously not experts on every single bill topic that gets referred to us, we work with content experts while abiding to a strict COI policy to help provide us with additional background and context for our work. And then they help make sure that our estimates and assumptions are reasonable. We also have our National Advisory Council that gives us another level of internal review to make sure that our analyses are neutral and reasonable. And then, of course, we have our brilliant students and interns that help support us throughout the peak season. Hold on one second, just to noted that there was a comment. So Gary, if you could monitor that would be wonderful. A little bit about our timeline. So from the day that we receive a request, we have 60 days to complete an analysis. And within that 60 days, a lot happens behind the scenes. I know that sounds really slow for a legislature, but it is actually quite quick for academia. So within that time, we have our TM analysis. We have several layers of internal reviews. There's external reviews, and then we finally do the final publication. And then this all happens before the first policy committee hearing, generally. It doesn't always happen. Sometimes we'll have an analysis ready for the appropriations committee. And this 60-day timeline isn't quite the very it's not the most firm deadline. Sometimes we are asked to do on a faster timeline than 60 days. But we don't love that. So the CHBRP staff and what our job is to manage each of the teams and write part of the analyses and manage all of the external relationships and contracts and administrative operations during all of this time. So before we get into the analysis, let's talk about what we are responsible for. Within California health insurance, there's state regulated insurance and there's federally regulated insurance. And if there's one takeaway for this is that CHBRP typically looks at the impacts of just state regulated insurance. So this is about a little over half of the population, around 23 million Californians. So there are a lot of bills that CHBRP looks at, and people sometimes make the assumption that the bills that CHBRP looks at will impact all Californians, and that's not necessarily true. They're often really specific to certain marketplaces. For example, within state regulated insurance, you've got these markets. So you've got large group, small group. Medi-Cal is a very large part of it, about a third. Then there's CalPERS and the individual markets. So we are looking at really like a slice of the population. Now getting into the bill analyses a little bit more. Typically, what you will hear associated with CHBRP's work is that we work on benefit mandates. And this is one of those funky terms that gets thrown around, but basically what we mean by this is that we're looking at coverage for a specific screening, test, or treatment of a particular disease or condition. So things like screenings for breast cancer or ACEs or colorectal cancer, these are things that we've looked at before. Another thing that's very common are a specific type or treatment of that's related to medical equipment or supplies or drugs. So this is specific services or surgeries, the types of drugs that are actually out there. So like the GLP-1s that were brought up, we did an analysis recently about those. And then finally, they've got services from a particular type of provider. So coverage for services from a licensed acupuncturist, for example. The other thing that we do is also repeals. So it doesn't happen very often, but we are authorized to actually look at what would be the impacts of taking away a mandate for coverage. But then there's also a lot of other things that we do. So we get a lot of cost sharing bills, we get healthcare financing bills, bills on parity, specifically related to the Mental Health Parity Act, reimbursement rates for providers, basically anything that relates or touches health insurance benefits is something that we might be asked about. So a little bit more on examples. This is a short list of what we have looked at in the past, and this is just in the last year. So menopause, cranial prostheses, also known as medical wigs, human milk, emergency medical services, and Medicare supplements. So that's a wide range of things that we've looked at. And then for 2025, we've already received 4 requests so far. We are anticipating more, but these also are a wide range of topics, including cost sharing, fluoride treatments, portable HEPA filters and purifiers, and insulin. And so when you look at our analyses, you'll have full analysis, you'll have 3 different sections, or big sections. The first one is the policy contracts in the background. And this is where we really are looking at kind of just giving an overall view of the landscape. So what's happening at the state level, what's happening at the federal level, and sometimes the local levels. related to whatever policy is in question that we're looking at. And we'll also look at specifically which markets would have to comply with this law should it be enacted. I want to make sure that everyone knows that we are not attorneys. We are asked to make reasonable interpretations of each bill that's referred to us. We do reach out to the regulators and administrators, so DMHC or CDI, California Department of Insurance, and DHCS, Department of Healthcare Services, to ask questions about bill interpretations. So for example, we'll often ask for confirmation of whether or not a bill would exceed essential health benefits. And if you don't know what that is, come to our next webinar. The next section that's really big is the medical effectiveness section. This is where we look at the existing evidence that's out there about the service and treatments that are most relevant to the bill. And then we grade that evidence. So is there really strong evidence that the test or treatment or service is effective or not effective? Or is there really only some? Or is there just not enough research out there to conclude anything? So all of that is laid out in our medical effectiveness section. And then the last couple of sections are really the impacts of the legislation. So pretty much every request that we receive is requesting a cost impact. And so we have a very sophisticated cost and coverage model that we update annually. This includes information on premiums and enrollment of different types of health insurance. This is something that we update over the fall and winter. So we'll ask the administrators for information on Medi-Cal. We'll ask CalPERS and the 8 largest health plans by enrollment to be able to develop this model. We'll look at the first year impact of a bill. So assuming that it's look like, sometimes we look at the second year, but it's pretty challenging to do that given how hard it is to predict how outside factors are going to impact the markets and consumer behavior. So we generally stick to the first year, but every so often, if things are going to be wildly different, you'll see a second year impact. And then finally, we look at the public health impacts. So based on what we've seen from the evidence in the medical effectiveness and what the cost estimates are, will there be an impact on the population health? And so this is another one of the big takeaways, is that there is a difference between individual health and population health. And what we're is, would this impact the population as a whole? Most times, the proposals that we are looking at will it make an impact or would make an impact in some way or another on an individual. But whether or not that would spread throughout to the entire population is different. I think an example of like a population health impact would be like tobacco cessation policies that would have a widespread impact. And so if you want more details on any of this, like how to read a CHBRP report and anything like that, we have videos on our website at www.chbrp.org that go into this a little bit more. Jumping into working with CHBRP. So first, I should say that we do have an important deadline tomorrow for anybody who's out there that working for a legislator on Valentine's Day. If you want to show the health committee a little love and let them know if you are planning on doing a bill that would touch CHBRP, that would be great. Otherwise, you would have to discuss about whether or not there's time for us to be able to analyze the bill. So how do you find out if your bill is CHBRP bound? Well, first, you should, it's really nice to have a nicely baked bill. And by that, I mean, it's not spotty language, there aren't going to be a ton of changes to the language, hopefully, to the bill before it is analyzed by us. Because any bill that we analyze is going to be in the form that which the legislature has asked us to analyze it. So if they ask us to review the introduced language, that's what we're doing. If there are a lot of changes that could potentially delay when a bill could be heard, or when at least when an analysis from CHBRP would be able to be available. So if you are thinking about introducing a bill, or your author's office is introducing a bill, please make sure to check in with the health committee to see whether or not they would or potentially could introduce that bill or send that bill to us. And then we have a ton of resources on our website. All of the bill analysis that we've done since 2002 are up there. And we have resources and publications on a lot of topics that are related to CHBRP's work. So what happens when bills come to us? First, we will, from an outside perspective, there's lots going on the internal side. But from the outside perspective, we will have a bill questionnaire, and we'll meet with the author's office and sometimes the sponsors if the authors want the sponsors there. And we'll ask kind of just to make sure that our interpretation of the bill language is aligned with what the intent of the bill was. So we might say, hey, we think it looks like this, it impacts these markets. And if that wasn't necessarily the intent, then there's more discussion about it. After a bill is introduced, there's 2 weeks for the public, so anybody to submit information to CHBRP for review. So we've already captured like a study that was submitted for our review, but other times, we get new things and we're human too. So we will take that into account as well and review any studies. We will not always, if the public does actually submit information, that information is not guaranteed to be part of our report. For example, if something isn't like particularly biased, once again, we are a very neutral party, and so we won't include information that is too biased, or if the study that was submitted doesn't meet the level of other studies do, or that in our work. Then during this time, we'll also confirm the interpretation of the language with the regulators and administrators. So this is when we talk to DMHC and CDI and DHCS, and try to make sure that we're aligned. And I know there's some DMHC folks out there, so we try to be as timely as possible with those requests. And please let us know if you have any questions about our questions. And then if necessary, there will be technical amendments. So again, the example that I talked about before, where if our interpretation is not what the author's intent was, there could be technical amendments about that. And then once we have completed the publication, we offer a briefing to the author's office and the sponsors, if the authors would like it, about the analysis, to provide kind of just a brief overview of the multiple page report that we've produced. So what do we publish? That massive bill analysis, if you look at our website, you'll see that most of them are somewhere between 50 and 100 pages. But we know that not everyone has time for that. So we have a shorter version in our key findings. This is usually somewhere between 2 and 5 pages. It's a little bit of a deeper analysis or a shorter analysis. You get some more bits and pieces. But we know that sometimes legislators and staffers don't even have time for that. So we have a fairly new product, which is our infographic or fact sheet that really gives the super high level overview of what the analysis does. And then all of the details and our assumptions and our sources, all of that is available in the bill analysis for when people need them. One other question that we get a lot is, how long are these analyses relevant? And the answer is almost always. So we have a spot on our website that's the status of bills page. And anytime there is an amendment to a bill, we try to update this website page within 24 to 48 hours of the bill being amended and being up on LegInfo. This the status update is not going to include a full update of the cost impacts, but rather we update whether the amendments may impact what we've analyzed and the impacts that we've predicted. And then if there are any changes, we'll state in more of a directional manner how those changes might impact the analysis and which parts are still relevant. Okay, now getting to some more fun stuff. We do way more than just analyses. I know that's when everyone sees us, but we do a lot more. So we have the resources that I've alluded to throughout the presentation. So we have a resource that when we've spoken to state agencies and some of the health plans and some stakeholders, is something that isn't necessarily available in some other common resources. So we look at the sources of healthcare coverage of all Californians and make an estimate every year. And that's one of the things that we base our cost and coverage model off of. And so we have that available, and it's coming out soon, I think in the next couple of weeks, on sources of healthcare coverage. We also will look at the pharmacy benefit. So how many people have coverage for outpatient prescription drugs, and where does that fall? And then we have a list of all of the California and federal mandates that have to do with health insurance. So hopefully that's useful to folks. We also, for anybody who needs a little bit of a refresher on some of the very complex topics that will go through Health Committee and beyond, we have some explainers that basically give a pretty brief overview of some of the common topics. So introduction to health insurance. If you're a first-time staffer who has no idea what's going on, that's a great resource for you. But we'll also go over things like what is cost sharing, what's network adequacy, like what does the population over 65 look like in California, and relate it to CHBRP's work so that folks have an idea of, it's a little bit better idea of how to interpret some of our work as they're reading through it. And then we have a newer product called Nuts and Bolts. And this is for those staffers who have no time. These really easy to read infographics. A lot of them are linked to the explainers. So it's like a short version of our explainers on things like, okay, what are enrollee healthcare expenditures? What does that mean? And what are they? What are essential health benefits? And what do pharmacy benefit managers actually do? And so we are trying to do more of these. We do a lot of this work over in the summer and fall, but we really want to be helpful to the legislature. And so if there is a topic that you would like your staff or your colleagues or just anybody to know more about, please let us know. We are happy to oblige. And a lot of our summer work is just kind of based on, hey, what did it seem like people needed? We ask people, is there anything else you want? And that's how a lot of our side hustle work is developed. So that is basically it. Please sign up for our listserv so you know information from us. We do not spam. I know everyone says that, but we don't. We basically give a newsletter. We send out a message of a notification saying that, hey, CHBRP is going to be analyzing such and such bill. And we send out emails with any big new resources and publications, and when we've completed analyses. So those are kind of the big things. So if those interest you, sign up. We're also on all of the social media. Well, a lot of the social media. So, meet us on the Butterfly or connect with us on LinkedIn. And this is, sorry, I threw this slide on last second. We do have another webinar coming up on February 27th, and this one's going to go much more into basics of healthcare or of California health insurance. We know that there's a lot of new staffers out there, and we would like to support you as you can. So if there's any information that you would love to have, let us know. We're putting together the materials as we speak. And that's it. So we'll open it up to questions for anyone that wants. Look, when we went not totally over. Ah, great. Has CHBRP already completed an internship application process? Oh, yes. My coworker is leading that effort, and I will ask her about your application.
I think we're in the final aspects of that process. So if you have not heard back, we will be reached out very shortly.
Yes. Any other questions? All right. We will hang out for another few minutes. And if anyone wants to ask any questions or has anyone afterwards, I will this is our general email address is info@chbrp.org. So feel free to email us at any time. And yeah, that's it. Thank you so much for coming.
Thank you. All right, I'm trying to find to turn off the recording. Are you able to turn off the recording, Anji? Oh, and a question just came in. Anji, are you still on?
Whoops, sorry, I was on mute. How much do we rely on information from USPSTF? Great question. Oh, sorry. Suzanne. That one's faster. Okay, so if we have a specific question about something in one of our analyses, who do we reach out to? You can definitely reach out to the info@chbrp.org at any time. That email is regularly checked, and you will be directed to the appropriate lead on that. So
yeah, it feeds right into my email box.
So yes, if you have a specific question, holler at us. And okay, going back to the USPSTF one. So it kind of depends on the bill. We will look at USPSTF if it's like, so I think I did like a prostate cancer screening bill a couple of years ago, and we relied pretty heavily on that one. The California Preventive Services Act does include references to USPSTF. So we do rely quite heavily on that, especially for like the grade A and B recommendations. And since that is what's in at least California statute right now, we will continue to go on or move forward with that. My assumption, you could correct me if I'm wrong, is that you're referring to the Braidwood versus Becerra case that's going on. We are kind of in a wait and see. We're going to continue to rely on USPSTF as long as it's out there. And we will also rely on what else is in the so it kind of depends on the bill. If there's one in specifically that you're looking at, let us know. But Garen, do you have any other?
Yeah, no, I think you hit it really well. I mean, obviously, it's a robust, credible source in our view, so it's certainly one of the sources we look at when we're sort of looking at the underlying evidence around a preventive service. But of course, it's not the only source, and usually USPSTF relies upon a whole bunch of research that already sort of supports that decision-making process. Obviously, when things have a crosswalk with coverage related to A and B recommendations, if the USPSTF were not there, that would raise some interesting legal questions about what to refer to. So something I think for the legislature to look at if need be. I think there's one more question about the case that you were referring to, Anji.
Yeah, I threw it in the chat.
Oh, okay. I'm sorry.
Yeah, Braidwood versus Becerra.
We appreciate folks joining us today. And as always, our inbox is always there, or contact us, one of us individually, if you have any questions. And we hope that you join, especially if there are if there are members of your teams or staff. We're still trying to wrap their heads around health insurance, finance, and sort of how things are set up in California. That session on the 27th should be really helpful. So we really appreciate everyone joining us today. And I'll turn off the recording, but we'll stick around for a couple more minutes.
Mhm.